Good morning, everyone. My name is Bob Ravenscroft, one of the vice presidents here at Bryan Health for our 101st media briefing on COVID-19. Hard to believe. We're going to do something a little bit different today. I have a couple of quick announcements, and then we're going to have Kelsey come up and share a very special story with you that we're very proud of her for participating in. Then we'll answer your questions. Some pre-submitted questions were delivered to us, and then our daily statistics with another message will come at the conclusion. So a lot of people are asking what they can do to help. Kelsey's going to demonstrate how she chose to help, but one other way you can do it is our blood bank partners really need some help right now. Before the pandemic, nearly 100 community blood drives were hosted every single month. That is now down over 80%. Additionally, a lot of first-time donors came from either our high school or college programs or their high school or college programs, bringing in over 1,000 first-time donors a year. That's down over 14%. How that impacts us is Nebraska's healthcare system requires about 1,000 donations a week just to maintain the adequate supply for what's needed to treat different patients. And so they're really in a dire need of help. Additionally, they're collecting convalescent plasma for COVID-19 patients. So the blood bank, blood donor centers have expanded their capacity and hours. You can certainly give at any of the 4 donor centers. You can also contact them if you want to have your own blood drive. And to do all of that, go to ncbb.org. Additionally, I would like to really send a shout out to the medical staff here at Bryan. They recognize this need, and they are having a challenge amongst the medical staff for the first 2 weeks of December to donate their own blood to care for the patients that they'll be entrusted for care. So that is one way you can help as a community. A second way people are choosing to help, and I would just like to thank, we had 8 more K through 12 schools deliver thank you cards and tokens of thanks that will be delivered to our staff starting on Thanksgiving Day, and will continue until they're gone. So thanks to these kids. Again, it was K through 12 this last batch, along with some other tokens, so greatly appreciated. After Kelsey gives her presentation, I'll come back up. We'll address questions that you might have of Kelsey, questions you might have of me, and we'll answer the pre-submitted questions before we give you the daily statistics. So Kelsey, the show's yours.
Good morning, everyone. I am Kelsey Anderson. I'm the provost at Bryan College of Health Sciences. Before I was provost, a major part of my job was teaching in our biomedical sciences department, both here and my previous institution, Concordia University in Ann Arbor, Michigan. I specifically taught microbiology, so living through and observing the response to this COVID-19 pandemic has been of particular interest to me. Almost all of my former students and current colleagues are frontline healthcare workers. They're fighting every day to save patients' lives while I am not doing that, nor have I ever been a frontline healthcare worker. However, I do thrive on getting things done and solving problems, but this pandemic makes me feel like I'm not doing anything to help. So when I first heard about the clinical trials for potential vaccines, I knew immediately that I needed to be a part of it. I didn't think twice about signing up. In fact, I want to get back to normal life just as much as the next person, and want that for my students and family as well. Enrolling in the vaccine trial seemed like something I could easily do that was safe and would contribute to the fight against COVID. I signed up in the summer, but did not get selected at first due to my work in an educational setting. I received my second call in September, and I went in the very next day. A lot of people I know thought I was crazy and were really worried about me and asked me if I was scared that I was going to get COVID from the vaccine. But something I know as a microbiologist is that I was not going to get sick from the vaccine, though I know that's a common misconception from immunizations, including the flu shot. So I enrolled in the Pfizer study, which we know now is over 90% effective. I am in the phase 3 trial of the Pfizer vaccine study, which includes somewhere around 40,000 volunteers. I received 2 shots that first one in September, and a second one 3 weeks later. The study is blinded, so I don't know if I received the real thing or the placebo, but I do know that after both shots, my arm was sore for a couple of days, nothing too bad, and I had minor chills the day after both shots. I now go back for routine visits. I went last week and they drew my blood and they're looking for immunity, and then I don't go back again until April, and then they will also follow me for the next 2 years to determine longevity of immunity. I also fill out a weekly COVID diary to indicate whether I'm exhibiting any symptoms of COVID. So far, I have not had any, but I also routinely practice mask wearing and physical distancing. So I'm super excited that I had the chance to contribute to this important milestone in the fight against COVID while also making science history. And I know that this whole pandemic will be taught to future classes of microbiology students. So I'm really grateful for that, and that I got to support the fight that my colleagues and former students are now facing. But most importantly, as the vaccine gets closer and closer to distribution, we have hope at the end of this very long tunnel. So thank you for letting me share my story.
Yes, we are, but the numbers are really tiny, and it's really hard to give you current information on this. What I can share is we received a report from the State Transfer Center on October 27th, the 28th, and then again on November 2nd, 3rd, 4th, and 7th. The one on November 7th was the last report we received from the Transfer Center, and at that time, over the previous 3-day period, we had received 5 patients from them. So I know when I was talking to the person who asked this question last week, I said there was 1 or 2 offs that would come from the Transfer Center. However, the bulk of them, the vast majority, are either coming from direct transfers from critical access hospitals or through our emergency department or a physician order. But yes, we have received some from the Transfer Center. Yes, you're seeing the same thing that we are today, and you'll see this, in the stats that go out to our members of the media in detail. But today, only 52% of our patients, COVID-19 patients, were from Greater Nebraska. And overall, we're kind of in a plateau period. Our hospital numbers have stabilized a little bit at a historical high level, but they've stabilized. But the amount of Lancaster County patients and Greater Nebraska patients is beginning to level out. I think under the surface, it's a little concerning because of the population density here in Lancaster County. 10 days ago, we had very large and very publicized gatherings downtown around a football game, and the downstream impact of that is still coming at us. Overall, we do expect a bit of relief these next couple of days, certainly with the electives going off, and then many other people, and physicians included, will try not to do things right before a holiday so the patients can be at home. So there's going to be a little bit of relief here, we believe, over the weekend, not for our ICU per se, but for other parts of the organization. Unfortunately, most likely not. Again, if you go back to March, you had that little blip and then it leveled out, and then May, June, you went out and it leveled off and dropped. Since basically September, when students came back, we've been on that sad upward trajectory. We think it's leveling off, but I think, as we've alluded to, there is concern around the holidays of Thanksgiving. Anything that happens over Thanksgiving, perhaps we'll see another elevated plateau then, and we hope what happens over Thanksgiving doesn't then take us right into Christmas, where you'll have other natural gathering times for families. So it's going to be a long while, and I want to reiterate, even with this plateau, when you see the numbers, we're at an extraordinarily high level, and it's a pretty precarious position for hospitals across the country. Maybe one other thing that's happening, back to the question that was submitted. Our critical access hospitals across Nebraska are doing a wonderful job, and more they are keeping as many patients in their local community until they absolutely need. So I think that's been again why you might see Lancaster and Greater Nebraska counties leveling a little bit. But also in general, with COVID-19, we've learned you don't take victory laps early in this at all. And we're certainly not doing that, and we're preparing for some tough months ahead. Yes, we do, and it's ready to be dusted off and utilized. What Aaron's question is getting to is, what do you do when you are out of space? And I think it's probably getting to, how do you make those choices on what standard of care do people receive? We're not at that point yet, but unfortunately in our surge planning document, that's something that needed to be addressed, that if we do get overwhelmed, how are those decisions made? Let's hope we never have to share those details with you. All right, everyone. You're in our thoughts and prayers, member of the media, general public, and certainly our team. So everyone have a joyous Thanksgiving. See ya.